Okay, so we use the dental probe in order to evaluate the overall periodontal health of a patient to record the pocket depths. The dental periodontal probe should be used in a very light manner. So use light grasps in order for us to achieve tactile sensations. So we stay parallel, we make sure that we stay parallel to the triangle of the tooth or from the long axis of the tooth. Okay, we walk the probe from line angle to line angle, and we make sure not to drag it or to impose too much pressure, as we don't want to be the one causing the bleeding on probing on the patient's soft tissues. So we base it from one line angle to another line angle by walking the probe and staying parallel on the triangle or on the long axis of the tooth. You walk the probe and we stay parallel to the long axis of the tooth. The 1-2 gracey curette is usually used for anterior teeth subgingivally on the cervical area. You start on the tip, okay, overlapping the midline while you are angulating it to the side. Okay, then you walk the hand instrument subgingivally. In a real scenario, you would be somehow blanching the soft tissue. Then you move towards the long axis and towards interproximally. Make sure that you have a finger rest while you are doing this in order for you to distribute the force. So you will feel that the tip of the hand instrument or the working side will be resistant and that you are able to remove the deposits. Do note that there is a difference in the level of the blade. So the lower side would be your cutting edge or your working side. For the anterior sickle scaler, this is used supragingivally, assuming that I am in my 12 o'clock position. So my handle and the shaft, even the working side, should be parallel to the long axis of the tooth. So if I'm coming from my 12 o'clock position, my movement would be from the cervical area of the tooth down to the incisal, okay, in one parallel motion. Okay, so ideally, if this is the patient, if this is a live patient, I would be retracting the soft tissue of the upper lip here. But since this is just a model, okay. So for this one, our movement would be cervical to incisal, supragingivally. You will feel that the blade or the working side would be resistant, and I will be able to remove the deposits. So the 7 and 8 gracey curette, this is mainly used for vertical and horizontal or diagonal motions that are specifically used within your premolars and molars, buccally and lingually. So this instrument is also used, or is mainly used subgingivally in the buccal and lingual surface. Okay. You will be able to see it on the lingual surface as well. So for the 11 and 12 gracey curette, you usually use this for the mesial side of your posterior teeth. So again, you also still have to identify which side is the working side for these hand instruments. The 11 and 12 instrument would have less complexity in terms of angulations of the hand instruments. So you start from the middle part while you are slowly engaging towards the mesial line angle. Okay. Subgingivally, you will feel that you are able to remove the plaque deposits. Okay. Okay, so for the 13 and 14, so this is mainly used for posterior teeth distally. The lower shank should be parallel to the long axis of the tooth. So you have to check the correct angulation if it is parallel to the long axis of the tooth, if the lower shank is parallel. Now there is a 70-degree angulation, but our movement should remain from subgingival area towards the occlusal area. So hand and wrist motions. Posterior sickle scaler is used supragingivally because the working ends or the blades are sharper for this instrument. So we make sure that the shaft is parallel to the long axis of the tooth before we adapt it. We have to check if they are already parallel to the long axis of the tooth. Then we start from line angle towards the middle of the cervical area. So you make sure that we move from the long axis or in the manner or direction of the long axis of the tooth. And once you are on the correct working end, you will feel that when you do your hand and wrist motions, when you do your scaling, there will be resistance because you are able to remove the calcular deposits. The double-ended sickle scaler provides ease and easy adaptation both on the anterior surface and the posterior surface supragingivally. So we are able to easily clean or remove the calcular deposits. Okay, so the neighbor's probe is used in diagnosis or diagnosing bone support or any furcation involvements, okay, in our posterior teeth. So because unlike the normal probe, the furcation or the neighbor's probe would be best suited for furcation involvements, okay, and evaluation of attachment levels and even periodontal pocket depths, and of course the various anatomical configurations of the molars.